Amber Hicks, and today I will be presenting on the Early Hearing and Detection and Intervention Program, also known as EHDI. What is EHDI? EHDI is not an organization like ASHA or AAA. EHDI is a program that falls under the Center for Disease Control and Prevention National Center on Birth Defects and Developmental Disabilities. EHDI is based in Atlanta, Georgia. EHDI identifies newborns and infants and enrolls them in special programs to ensure they develop essential language and cognitive skills. Many, but not all states and territories have EHDI programs. Since EHDI is not a program like AAA or ASHA, or since it is not an organization like AAA or ASHA, but it is a program, there are no joining fees or membership dues. Their vision states that they are a program that is here to promote communication from birth for all children. Their mission statement says, the mission of the CDC EHDI program is for every state and territory to have a complete EHDI tracking and surveillance system that ensures children with a hearing loss achieve communication and social skills equal to their cognitive abilities. Without early identification and intervention, children with hearing loss may experience delays in the development of language, cognitive, and social skills that may prevent success in academic and occupational development. The three main goals of EHDI are 1-3-6. Many of us have heard of the 1-3-6 plan. Goal 1, screen babies before 1 month old. Ideally, this will be done in the hospital. Goal 2, follow up on babies before they are 3 months old. Goal 3, begin providing early intervention services before the baby is 6 months old. There are actually 7 goals that EHDI addresses, but most people, including most audiologists, are most familiar with the first 3. Goal 4 states that all infants and children with late onset, progressive or acquired hearing loss will be identified at the earliest possible time. EHDI says that tracking must go on beyond the 1-3-6 plan. There is a need for providers to continue to track young children who were missed or not identified at birth for various reasons. Goal 5 says that all infants with a hearing loss will have a medical home. PCPs play a principal role in the success of EHDI. It is critical for the PCP to explain the medical care to families and for the services to be coordinated between the medical home and the EHDI program. This ensures that the child receives the medical services they need and that the parents are made aware every step along the way. Goal 6 says that every state will have a complete EHDI tracking and surveillance system that will minimize loss to follow up. The tracking should include infants and children that have been identified with the hearing loss, as well as children who have risk factors for late onset or progressive hearing loss. Goal 7 says that every state will have a comprehensive system that monitors and evaluates the progress of the EHDI goals and objectives. It is important for the states to constantly evaluate their program and progress. They should also include families in every step. EHDI recommended treatment and intervention services. No single treatment or intervention is the answer for one child or family. EHDI recommends early intervention from 0 to 3 years old, and then special education continuing from 3 years to 22 years old. Good intervention plans will include professionals and work at home, as well as constant monitoring and adaptation. Intervention services also include amplification and oral rehabilitation therapy. Families should contact local providers like audiologists or primary care physicians for additional information based on needs. I've also attached the link here where you can see the list of all of the EHDI providers within each state, or the EHDI coordinator for each state. So if you have any questions, it lists their address, telephone, and additional email contact information. How does EHDI work? Newborns are given hearing screening before hospital release. This isn't an ideal situation. Even though EHDI is in place, there are at-home births and births through midwives. Those children can tend to fall through the cracks, which is why EHDI continues to have follow-up. If a newborn does not pass, EHDI follows up. Follow-up is important because this is just a screening. It is not an official diagnosis of hearing loss. EHDI outreach. There are 2 main outreach programs that EHDI offers. The first is the annual EHDI conference, and the second are EHDI teleconferences. The EHDI Annual Conference has built a reputation for bringing together a wide variety of people. Participants include representatives from state and federal agencies, academics, and families. The EHDI Conference is in its 11th year. It is a great opportunity for professionals to interact with children and families. EHDI recommends that anyone from audiologists and SLPs to families and advocates should attend this conference. The EHDI Conference is unlike a lot of other professional conferences. They really encourage families of children with hearing loss and individuals with hearing loss to attend. It's a really great opportunity to see your work as an audiologist in action. You get to talk to parents, and you get to see how your work is directly affecting them and how their children are succeeding through the goals that EHDI has set forth and the audiologists are acting upon in their practices. The EHDI Conference has co-sponsors, the American Academy of Pediatrics, the CDC, the HRSA, and NCHAM. NCHAM plays a huge role in EHDI. It's the National Center for Hearing Assessment and Management at Utah State University. If you look up EHDI on the website, you will see that a lot of their additional resources are offered through NCHAM. The EHDI teleconferences are typically held on the fourth Thursday of February, April, June, August, October, and December. Teleconferences are typically held at 4 p.m. Eastern Time. They are designed to be a forum to discuss current EHDI issues. The forums are designed to discuss the current EHDI issues, ideas, and activities with people working in fields related to newborn screening. You can obtain past transcripts from the CDC website if there are any topics that they've already covered that you would like to listen to. Finding an EHDI program. Today there is an EHDI program in every state, not all territories, but in every state. This is the link that will send you to the EHDI coordinator for each state. Each state has a unique EHDI program, and their ideas of intervention are slightly different. So depending on what state you live in, you will want to contact your EHDI coordinator to know how your state is acting and what your plan of action will be with your child. EHDI also offers additional materials on their website. If you have access to the internet, EHDI has free materials further explaining the intervention process. If you don't have access to the internet, you can contact your audiologist or local early intervention office, and they can get the materials sent to you. I hope that you've enjoyed my presentation. These are my primary resources, and I'm Amber Hicks. I hope you learned a lot about early detection and hearing intervention. Thank you.